Mr. Chairman, my speech will cover the Ministry's efforts in three areas. Firstly, on reshaping our norms and choices in healthy living. Secondly, on maternity costs and fertility preservation. And lastly, on ensuring a robust healthcare workforce. We have made strides in our efforts to reduce sugar consumption. As shared by Minister Ong, we will also tackle the issue of excessive intake of sodium and saturated fat. Ms. Ng Ling Ling asked about the plans for extension of Nutri-Grade labelling for sodium and saturated fat in the F&B setting and the healthier alternatives that are available across cuisines. We understand from engagements with industry that tackling sodium and saturated fat content in eat-out dishes is challenging. Given the diversity of cuisines in Singapore, the different cooking process and recipes can lead to variations in the amount of sodium and saturated fat in a dish. Moreover, time is needed for consumers to adjust their palates to lower sodium dishes and for F&B operators to adopt healthier ingredients. Therefore, we are not applying the Nutri-Grade measures to dishes in the F&B setting for now. Instead, we are strengthening our engagements with F&B operators. This includes ramping up voluntary storefront labels to help consumers identify stores that offer healthier dishes, either by using healthier ingredients or using less salt or sauces when cooking. Besides encouraging F&B operators across various cuisines to use healthier ingredients and provide more healthier options through the Healthier Dining Program, HPB is also actively engaging our hawkers on the importance of sodium reduction and providing them with samples of low-sodium ingredients. HPB has reached out to 60 hawker centres, with 50 more planned for 2025. The availability and affordability of healthy ingredients for F&B operators and consumers is key to the success of our efforts. To this end, HPB's Healthier Ingredient Development Scheme supports manufacturers and suppliers in their reformulation efforts while reducing the price gap between healthier and regular versions. These efforts have borne fruit. Today, over 1,700 eateries, including stalls in hawker centres, have switched to lower sodium ingredients compared to 500 eateries 2 years ago. We will continue to build on these efforts to advocate for healthier meals that are lower in sodium, saturated fat, and sugar. Besides healthy eating, we must support active living. Mr. Chairman, allow me to share the broader picture of healthy lifestyles and our progress towards shaping an active nation. I thank Ms. Ng Ling Ling for her concerns on plans to increase participation in the HPB-led physical activity programs and efforts to reach out to healthier SGGP clinics to support these programs as part of social prescription. HPB conducts regular fitness programs that are accessible and convenient for residents in the neighbourhoods. These community physical activity programs have been expanded to over 2,100 sessions each week, up from over 1,700 sessions in 2023. These activities are also now held at more than 1,300 locations. HPB has also expanded their program offerings to cater to different segments. These include programs such as Steadila and Happy, Healthy Aging Promotion Program for you, to address frailty for seniors, Active Family Program for young families, and Start to Move Program for individuals looking to kickstart an active lifestyle. Everyone can now participate in activities suitable for their fitness level and at a convenient location. We are heartened that the programs have been well received by Singaporeans. Alongside the increase in physical activity programs, the weekly attendances for these have increased from 36,000 participants in 2023 to 47,000 in 2024. To support healthier SGGP clinics in encouraging appropriate physical activities for residents, HPB has also developed a guide to lifestyle prescriptions available on the Agency of Integrated Care AIC webpage. The Healthier SG Events Go Where portal was also launched last year to provide GPs and their care teams with a consolidated list of healthy lifestyle programs from HPB, People's Association, Sport SG and Active Aging Centres to recommend to residents. As we continue to build the infrastructure to encourage physical activity in the community, we have also been listening to residents' feedback. We understand concerns over late arrivals and registration capacity for physical activity programs. Some residents may also be unsure about the sign-up process. In response, HPB will exercise greater flexibility. For low and moderate intensity activities including yoga, Zumba Gold and resistant band exercises, latecomers and walk-ins will be allowed, subject to capacity limits. For safety reasons, higher intensity activities like high-intensity interval training, HIIT, will still require punctual arrival as proper warm-up and safety checks are needed to minimize injuries. We encourage everyone to sign up for the activities via the Healthy 365 app and arrive on time. Prior to participating, residents should also monitor their own readiness and refrain from exercising if unwell. With the changes, we hope more residents will join the variety of physical activity programs conveniently located in their neighbourhoods. We further recognise that some may prefer to exercise at their own pace and time. HPB offers virtual physical activity sessions on Zoom and self-directed digital programs. An example is the 12-week Age Strong program, which was launched in November 2024 on the Healthy 365 app, catering to residents aged 50 years and above. Participants can take part in customized workouts and learn about nutrient-rich diets and mental well-being. The program also provides health points for completion of daily tasks. In response to user needs, HPB has also enhanced the Healthy 365 app with a new goal-setting feature and a refreshed set of milestone-based challenges in October 2024. Users can set personalized activity goals for their physical daily activity and sleep duration to suit their preferences and daily routines and earn rewards for meeting their goals. Today, more than 840,000 residents regularly use the Healthy 365 app to track their progress in meeting their activity goals, access lifestyle activities, recommended resources and programs, and earn rewards from completing tasks and challenges. For those who have yet to come on board the Healthy 365 app, I urge you to be part of this journey to take steps towards better health. An area of growing concern that impacts on health and lifestyle is vaping. Mr. Ang Wei Nang has expressed his concerns on this matter and urged stronger enforcement efforts. The Ministry of Health, in collaboration with various stakeholders, has intensified our whole-of-government approach to combat vaping through public education and enforcement efforts. As Mr. Ang pointed out, there are some common misconceptions around vaping, and to this end, HPB has launched a series of campaigns over the last 2 years to increase awareness of the illegality and harms of vaping. To further amplify awareness, multiple channels, including social media and youth content creators, were engaged to more effectively reach the intended target audience. Relevant stakeholders will continue to work closely to raise awareness among children and youths on the harms of vaping. On the enforcement front, the Health Sciences Authority, HSA, has increased enforcement operations, especially in public vaping hotspots, alongside other agencies such as the National Environment Agency and National Parks Board. Collaboration with the Immigration and Checkpoints Authority has also been strengthened to combat the smuggling of e-vaporizers at the borders. In educational institutions, the Ministry of Education maintains a firm stance against vaping, with disciplinary actions taken and referrals to HSA for offenders. Looking ahead, MOH and HSA will be reviewing legal penalties to bolster deterrence against the importation, distribution, and use of e-vaporizers. Education and enforcement against vaping is a long-term effort, which will be continually monitored and reviewed to ensure we address the vaping issue effectively. Mr. Chairman, allow me to say a few words in Malay. Dalam usaha menggalakkan kesihatan, kita perlu ambil pendekatan yang khusus dan bersesuaian dengan golongan masyarakat yang ingin dijangkau. Ia hanya boleh dilakukan dengan berkesan sekiranya kita bekerjasama dengan kumpulan dan organisasi yang berbeza dalam masyarakat. Buat masyarakat Melayu Islam di Singapura, ini dapat dicapai melalui rangkaian Jaga Kesihatan Jaga Ummah JKJU yang merangkumi pelbagai organisasi termasuk agensi-agensi M3, Pertubuhan Melayu Islam dan organisasi keagamaan. Rangkaian ini yang awalnya bermula dengan beberapa buah masjid sahaja telah berkembang dan terus berkembang. Jumlah rakan kongsi telah meningkat daripada 100 pada tahun 2023 kepada 160 pada tahun 2024. Di acara sihat bersama JKJU pada bulan Februari yang lalu, kita telah mengiktiraf rakan-rakan kongsi dan terus menggalakkan mereka untuk berkolaborasi. Rakan-rakan kongsi kita juga dapat mempamerkan usaha mereka di reruai-reruai yang terbuka kepada halayak ramai. Pada sesi Town Hall bersama saya, Dr. Wan Rizal dan Puan Nadia Samdin, kita membincangkan secara jujur masalah kesihatan yang dihadapi oleh masyarakat kita, bagaimana ia memberi kesan kepada aspek sosioekonomi kita dan cara-cara untuk mempertingkatkan usaha memelihara kesihatan secara menyeluruh. Saya terkesan dengan perbincangan itu dan komitmen rakan-rakan kongsi kita untuk membuat perubahan dalam pada kita melangkah ke hadapan. Kita telah pun masuk ke dalam bulan Ramadan dan akan meneruskan acara-acara yang dirancangkan. Tahun ini saya berbesar hati melihat rakan-rakan kongsi JKJU mengembangkan dan menuju ke arah pendekatan kesihatan yang lebih menyeluruh sambil menyesuaikan aktiviti mengikut keperluan masyarakat. Sebagai contoh, ada beberapa rakan kongsi MOS 3 bekerjasama dengan rakan sumber JKJU seperti Caregivers Alliance Limited dan Pasukan Peningkatan Perkhidmatan Strok SSI di bawah Kementerian Kesihatan untuk mengendalikan ceramah kesedaran kesihatan mental dan strok sepanjang Ramadan ini bagi menggalakkan pemeriksaan kesihatan dan kesejahteraan mental. Sememangnya Ramadan menyediakan peluang yang baik bagi masyarakat kita untuk memilih gaya hidup yang lebih sihat. Saya menyeru masyarakat untuk mengambil kesempatan pada masa ini dan membuat perubahan positif dalam kehidupan kita. For the next part of my speech, I will focus on family and fertility, which is an issue close to the hearts of many in this house. Ms. Sylvia Lim asked about the differences in maternity fees for Singapore citizens and permanent residents as compared to non-residents. We understand that healthcare costs are an important consideration in setting up a family, particularly for transnational families. Hence, foreign mothers who are married to Singapore citizen fathers and who are PRs or on long-term visit pass plus, LTVP plus in short, can receive Singapore citizen level subsidies for delivery episode in recognition that their child will be a Singapore citizen, and PR level healthcare subsidies for all inpatient subsidies. In fact, the vast majority of foreign mothers married to Singapore citizens and with SC children are PRs or LTVP plus holders, and they would be eligible for these subsidies. Expectant mothers married to Singapore citizens may apply for an LTVP, and those who are eligible for an LTVP plus will be granted subsidies accordingly. Beyond subsidies, the MediSave maternity package also allows couples to use their MediSave for their delivery and pre-delivery expenses. Singapore citizens or PR fathers whose spouses are giving birth in Singapore may tap on their MediSave to defray the out-of-pocket cost for their maternity fees. For some individuals, however, the ability to build a family may be irreversibly compromised by medical treatments that are required to treat conditions such as cancer. Such treatments can significantly impair one's fertility. I thank Dr. Tan Wu Ming and his healthcare worker peers for tirelessly advocating for young cancer patients seeking fertility preservation. We agree that no one should have to forgo the opportunity to have a child because of the side effects from a medically necessary treatment for a condition. Hence, from June this year, we will extend subsidies for embryo, egg and sperm freezing for those whose fertility can be irreversibly affected by their medical treatment. From next year, we will also extend MediSave coverage for embryo freezing and MediShield Life coverage to support embryo, egg and ovarian tissue freezing for such individuals. Those who still face challenges with the cost of their fertility preservation treatments arising from medically necessary treatments may also approach medical social workers at their public healthcare institutions for further assistance, including to apply for Medifund. With these changes, we hope to assure patients facing medical challenges that their dreams of starting a family in the future are still within reach. Mr. Chairman, allow me to move on to healthcare manpower. A strong healthcare workforce is vital to support both our preventive health initiatives and treatment needs, and we remain committed to building this capacity. I thank Mr. Louis Ng for his concern on rest time for nurses. The well-being of our healthcare workers, including nurses, continues to be a perennial concern. There are clear practices in our public healthcare institutions to ensure that nurses have sufficient rest during shifts. For example, nurses take staggered breaks during their shifts so that there is sufficient rest time for each nurse. Dedicated rest areas separate from clinical spaces are also provided to ensure breaks are uninterrupted. Between shifts, the clusters limit the number of consecutive working days. Efforts have also been made to streamline processes and reduce administrative tasks so that nurses can complete their duties efficiently and end their shifts on time. Today, the attrition rate of nurses in the public healthcare clusters has dropped from 9% during the pandemic years of 2021 to 2022 to around 6.7% in 2024. This decline in attrition, coupled with our sustained efforts to recruit new nurses, is helping to strengthen our nursing workforce and improve working conditions on the ground. Mr. Ang Wei Neng asked about dental manpower sufficiency. To meet Singapore's evolving dental needs, the National University of Singapore has increased its annual dentistry intake by 50% from 2015 to 2024. The number of registered dentists also grew by 35% in the same period, bringing our dentist to population ratio to 0.5 dentists to 1,000 people. This is on par with other developed countries such as South Korea and the UK. Our local dentistry program remains a steady and sufficient source of new dentists, and hence we do not currently provide pre-employment grants for dentistry. We will continue working with local institutes of higher learning to meet national manpower needs for dental care. Nonetheless, dentistry students who choose to study overseas are welcome to return to Singapore to contribute as our healthcare needs expand. Mr. Chairman, in closing, health is more than the absence of illness. It is about the quality of life for ourselves, our families, our communities. From nurturing healthy habits to family planning and ensuring the well-being of our healthcare professionals, we are building a system that supports Singaporeans at every stage of life. This journey requires our collective commitment, and together we can build a Singapore where every individual has improved opportunities and access to a more well-rounded, healthier life. Thank you.